the United States is facing a concerning outbreak of measles, a highly contagious and potentially deadly disease. This outbreak serves as a stark reminder of the importance of vaccination and the potential consequences of declining immunization rates. As of late March 2025, over 480 cases of measles have been confirmed across 19 states. This represents a significant increase from previous years and highlights the vulnerability of communities with low vaccination rates. The Centers for Disease Control and Prevention, or CDC, has reported that the vast majority of cases, nearly 97%, are in individuals who are not vaccinated against measles. This underscores the critical role of vaccination in preventing the spread of this dangerous disease. Measles is a highly contagious viral illness that spreads through the air when an infected person coughs or sneezes. Symptoms typically appear 7 to 14 days after exposure and include fever, cough, runny nose, red eyes, and a characteristic rash. While most people recover from measles without complications, some individuals, particularly young children and those with weakened immune systems, can develop serious complications such as pneumonia, encephalitis, and even death. The current outbreak has already resulted in 2 fatalities, highlighting the potential severity of this disease. The resurgence of measles in the U.S. is a serious public health concern, underscoring the importance of maintaining high vaccination rates to protect individuals and communities from preventable diseases. The CDC recommends that all children receive 2 doses of the measles, mumps, and rubella, or MMR vaccine, with the first dose given at 12 to 15 months of age and the second dose at 4 to 6 years of age. Vaccination is the most effective way to prevent measles and protect ourselves, our families, and our communities. The epicenter of the current measles outbreak is Texas, where over 400 cases have been reported, with the majority concentrated in Gaines County. This region has experienced a concerning decline in vaccination rates in recent years, leaving a significant portion of the population susceptible to the measles virus. The outbreak has particularly impacted children and teenagers, with over 300 cases reported in individuals under the age of 18. The spread of measles in Texas has been linked to several factors, including low vaccination rates, holiday gatherings, and travel. Gaines County, in particular, has seen a significant increase in vaccine exemptions over the past decade, leaving a growing number of children unprotected against measles. This trend is concerning as it creates pockets of vulnerability within the population, making it easier for the virus to spread. The outbreak in Texas has also highlighted the importance of herd immunity in preventing the spread of infectious diseases. Herd immunity occurs when a high percentage of the population is immune to a disease, making it difficult for the disease to spread. When vaccination rates decline, herd immunity is compromised, leaving vulnerable individuals, such as infants too young to be vaccinated and individuals with compromised immune systems, at risk of infection. The situation in Texas serves as a stark reminder of the importance of maintaining high vaccination rates to protect our communities from preventable diseases like measles. The spread of this outbreak underscores the need for continued public health efforts to promote vaccination and address vaccine hesitancy, ensuring that all individuals have access to the protection they need. The current measles outbreak has brought to light the concerning issue of vaccine hesitancy, which has contributed to declining vaccination rates in some communities. Vaccine hesitancy, fueled by misinformation and unfounded fears about vaccine safety, has led some parents to delay or refuse vaccination for their children, leaving them vulnerable to preventable diseases like measles. The spread of misinformation, particularly online and through social media, has played a significant role in fueling vaccine hesitancy. False claims about vaccines causing autism or other health problems have been debunked by numerous scientific studies, yet they persist and continue to influence parental decisions about vaccination. In addition to addressing vaccine hesitancy, understanding the genetic makeup of the measles virus circulating in the outbreak is crucial for public health officials. The CDC has been analyzing samples from infected individuals to determine the specific strain of the virus and track its spread. Initial findings indicate that the outbreak in Texas is primarily driven by the D8 genotype of the measles virus. Genetic analysis of the virus can help determine the origin of the outbreak and identify any potential links to other cases or outbreaks. This information is essential for implementing effective control measures and preventing further spread of the virus. By understanding the genetic makeup of the virus, public health officials can better target vaccination efforts and develop strategies to interrupt transmission. Combating misinformation and restoring trust in vaccines are crucial steps in addressing the current measles outbreak and preventing future outbreaks. Public health officials, healthcare providers, and community leaders all have a role to play in providing accurate information about vaccines and addressing concerns raised by the public. It is essential to engage with communities where vaccine hesitancy is prevalent and address their specific concerns with empathy and evidence-based information. Public health campaigns should focus on the safety and effectiveness of vaccines, highlighting the overwhelming scientific consensus that vaccines are safe and effective in preventing serious diseases like measles. It is also important to emphasize the risks associated with not vaccinating, both for individuals and for the community as a whole. Healthcare providers are trusted sources of information for many people and play a vital role in addressing vaccine hesitancy. Open and honest conversations between healthcare providers and patients about vaccines can help address concerns and build trust. Providers should be equipped with the knowledge and resources to effectively communicate with patients about vaccines and address their questions and concerns. The current measles outbreak serves as a stark reminder of the importance of vaccination in protecting public health. By addressing vaccine hesitancy, combating misinformation, and ensuring that all individuals have access to vaccines, we can work towards achieving and maintaining high vaccination rates, protecting our communities from preventable diseases, and safeguarding the health of future generations.